I want to speak to our Oakland University community. I know that we are now living in an unprecedented time for both our community here at Oakland University, within the state of Michigan, and across for our entire nation. And I know that this week we put out an announcement that indicates that we suspended our face-to-face classes and a series of other mitigation measures that I know have really challenged our entire community. Some people have been extremely concerned, and in fact, I know this might have created a sense of panic for some members of our community, and others have really questioned whether all of these measures are necessary. And so today, I thought it would really be good if I spent some time talking to our community and explaining why we are doing the things that we are doing. I think it's important to note that all 15 public universities in Michigan have done something very similar to what we have done and have suspended classes. And in fact, Governor Whitmer today announced that all public schools should also be closed across the state of Michigan. And I know across the country, many public gatherings have also been suspended, and there are many other measures that are being taken across the country. So this is really a scary time for so many people. And I thought that as your president and also as a physician, that it might be an appropriate time for me to explain to you several things. First and foremost, it is not a time for anyone to panic or to fear this very unusual COVID-19 virus. And yet it is a time for us to take these measures very, very seriously. And I thought I might talk to you a little bit about why that is. This virus has caused a pandemic. What is a pandemic? A pandemic is an infection which is occurring across the entire world. And that means that it is something that is very serious. Why is it so serious? It's serious because we do not have a treatment for it, and we do not have an immunization for it. And it is one of the most infectious kinds of viral infections that we've ever seen. Now, we know that the case fatality rate, which is called the CFR, is somewhere around 1 to 3%. That means that 1 to 3% of the people who get infected with this virus are believed to die. Why don't we know with certainty what the fatality rate is? The main reason we don't know is because we don't actually know the denominator. We don't really know how many people are diagnosed with this virus. And that's because we don't have enough diagnostic kits. People who feel ill can't always be diagnosed. And that is the reason we don't actually know the number of people who die. But even at the high end, that means that 97% or more of the people who do get ill with this virus survive. And that's one of the reasons that there is no real reason to panic. And the people who are at greatest risk for this infection are the elderly and those with pre-existing conditions. On the other hand, we want to stop this virus in its tracks, and we want to mitigate against future infections. And that is why we are moving so aggressively to try to stop this virus from infecting additional people. And that is the reason why we took the measures that we took here at Oakland University when there were only 2 cases that were identified here in Michigan. We were preparing for this for several weeks, and I want to applaud the Corona Task Force here at Oakland University, people on our campus, your leaders, that had been working day and night to prepare for this for several weeks. And if you meet people like this on our campus, I want you to thank them for the work that they were doing. One way to know that this virus can and is spreading rapidly is that within the 2 days since the original 2 cases were diagnosed, we now know that there are at least 10 additional cases right here in Michigan. And I personally believe that there are many more, but because we're underdiagnosing them, we just don't know how many there are. So if you have symptoms of a viral infection, I encourage you to contact your healthcare provider, or if you're a student here on campus, please contact the Graham Health Center and let people know. But don't panic, just let us know. And we can get a test kit here at the Graham Health Center. And please do that because it's very important. Also, please follow the measures that we have identified on our website. If you aren't certain what those are, they're at oakland.edu, and we have a special page for the coronavirus, and please look at that. And that reviews everything that we want to tell you. I want to now explain why it is so important that we stop this virus in its tracks. And I'm going to show you a chart that some of you may have seen if you're looking at the news, watching any of the television stations, or reading the newspaper. And this is a chart that you may have seen that's called Flattening the Curve. And we are very concerned about this. So if you've looked at any of the newspapers, the New York Times, or the Wall Street Journal, or if you've watched this on TV, you will see a chart that looks something like this. And if you see right over here, when the virus was first diagnosed in the United States, when you saw the first cases that came into the West Coast, that came from that cruise ship, there were only a few cases right over here. But what we're concerned about is that as the virus multiplies exponentially, there will be this huge spike of cases. And if there are no mitigation procedures, this spike can overwhelm our health system. This is what is happening right now in Italy. And if you're reading about what's happening in Italy, you understand that there is an overwhelming number of cases that is impacting the health system there. And the health system in Italy is unable to keep up with the number of cases that are being diagnosed. So the medical system there, including the health professionals, are getting sick. And there are more and more cases that cannot be adequately treated. And this is something that we want to prevent here in Michigan and across the United States. That's what happens if the virus is not stopped quickly. And that is what we're seeing here with this very rapid spike. We believe that we can flatten the curve by these very aggressive mitigation procedures that we've implemented here at Oakland University and that Governor Whitmer has recommended across the state and that others are suggesting across the United States. All of the measures that are on our website and that we outlined earlier this week. And that's what you see here in this curve that is the example that's called cases with protective measures. We don't think that we will reduce the total number of cases that will actually occur. People will still get sick with the coronavirus, but they will happen over a longer period of time. Why is that a good thing? Because here, the healthcare system will be able to treat those cases, and that will allow us to not overwhelm our healthcare providers. We will have more ICU beds, we will have more healthcare professionals. The healthcare professionals themselves will not get sick. But there are 3 additional good things that can happen by allowing this to take place over a longer period of time. 1, we hope to have immunizations by 12 to 16 or 18 months from now. 2, we hope that there will be antiviral medications that will also treat this disease if these cases get sick in a longer period of time. And 3, we again hope that the healthcare system will be able to adapt. And that is the reason why these mitigation procedures are so very important. So these are the reasons why it is critical that we do all the things that we have outlined. Wash your hands, keep a distance, don't have gatherings. That is why we have moved away from face-to-face instructions and face-to-face classes and instruction. all the things that we have told you to do. So I hope you understand some of the reasons why we feel that all of these measures are not excessive and we feel that they are appropriate. I want to take a couple minutes and talk about a few other things that really matter to me and that I think are so important. I have heard about a few very disturbing things that happened on our campus, and they're not consistent with the Oakland values. And this really is very disturbing to me. You know that the first cases of this virus occurred in China, in Wuhan. And I have heard of 1 or 2 cases where individuals who came from Asia or who look Asian were discriminated against on our campus. I find this hard to believe because Oakland University is known for being a warm and welcoming place where everyone is considered a part of our family. I certainly hope that during this challenging and difficult time, that we will remember that everyone here at Oakland University is part of the Oakland family, and that we will not exhibit any racist, intolerant behaviors against any individual or any groups. This is a place where we exhibit values of tolerance and where we welcome all. And this is particularly important to me during this challenging and difficult time. Additionally, I want to remind everyone of our values of community engagement and service. This is a very challenging and difficult time for so many people. We're asking people to adapt and do new things. We're asking our faculty to learn how to teach in new ways. And I want you to be patient with them and with us as administrators. All of us are going to make mistakes. Our students have to adapt and learn new things. We've asked our students to learn in a new way as well. Some of our students have left our campus, but others are still here. And although we have suspended classes, all of our services are still open. But we're changing things. And so I'm asking people to be patient with us as we're trying to do things in a new way. But we know we're going to make mistakes. Tell us when you think we can be better, and we'll do our best to do that. And I hope that people will be understanding. It's a great opportunity for us to come together as a community and to do our very best. We are truly a resilient and a capable community. And I know that it's a time for us to also help others. Think about who in our community is most vulnerable and how we can help those. The people most at risk for this virus are the elderly. So who can you help? Is it your parent or your friend's parent? What do they need? People are going to be asked to stay at home. Are there people who are particularly lonely? What might you do for them? And now that schools are closed, what does that mean for parents of young children, people who have to now work at home? Now that schools are closed in inner cities like Pontiac and Detroit, many of those children have depended on the school system for food, and some of them don't get a hot meal if they aren't at school. Can you do something to help them? And there may be some who are dependent upon work for income. Think about ways that you might be able to help others. I'm certain that while this is an enormous challenge for every single person in the Oakland University community, there is someone who has it worse than you. And I ask that each one of us think about that. I want to thank everybody for your patience, for the work that you do. I want to again thank the Coronavirus Task Force at Oakland University for everything that you've done to date. And I know that you'll be hearing from us again soon. And I want to really acknowledge how outstanding each one of you is. And I want to thank you for everything you've done to help me during what has been a challenging few weeks. Thank you.